This presentation is for the School of Nursing's clinical faculty, and it will be an introduction to debriefing. My name is Will Sana. I'm the Simulation Education Technologist for the Goldstein Interprofessional Sim Labs. My goal for this presentation is to present the fundamentals of debriefing as we do it here at Northeastern. So what is debriefing? It's the most important piece of a simulation. Simulations have many different applications and styles. Here at Northeastern, one of our primary applications of sim is in reflective practice using high-fidelity mannequins or standardized patients. Debriefing is a key element in all of this. Debriefings immediately follow the simulations, and they are arguably where the majority of the learning takes place through reflection, giving, and receiving feedback. What we're focusing in on the debriefings we do with our undergraduate nursing students is not their procedural technique or their skill mastery. It's about how they're thinking. Oftentimes our instinct is to latch on to what we're sure of and can speak about from a position of authority, such as technical skills. But in these debriefings, the focus is on how the students arrived at the conclusions that they did, what influenced them to make the choices that they made. The learning component can be a two-way street as well. While your students have a tremendous learning opportunity, this is also a chance to get feedback from them on how the simulation felt to them. You can use their responses to strengthen or polish your own sims. Without a debriefing, a simulation is not effective or helpful. Unless time is taken to review and unpack the simulation, why do it in the first place? Generally speaking, a debrief should be about twice the length of a sim, sometimes with two debriefers as well. One of your debriefers is always going to be the lead. The other will be the associate, or sometimes referred to as the subject matter expert. The associate or subject matter expert will help fill in the gaps, add anything that the lead may have missed, assist the lead, and be a second set of eyes. As the name suggests, the lead will lead. If you have two people trying to run a debriefing down two separate paths, things can get chaotic. Between the end of the simulation and the beginning of the debriefing, there's a short window of time in which you and your associate debriefer can establish a plan on how you're going to debrief the case and what your focal points are going to be. Keep in mind that this is more like an outline or a framework than a closely followed script. There are many things that can happen in a debrief that may shift the focus away from what you are anticipating. When I debrief, I like to keep my major points to a maximum of 3. This way I can effectively explore my topics and not overwhelm the students. The simulations you'll be running down here will have all been built around learning objectives. These may be focused on clinical details, teamwork, SBAR communication, or perhaps another aspect. These can be translated into your clinical coursework as well. And you can use these objectives to really help focus your structure of your debriefing. So there are 3 phases of a debriefing. The reactions phase, which allows your learners to express how they're feeling. Simulation's often in a very emotionally charged experience. Your learners often come out of the sim cognitively activated. Until they get a chance to express how they're feeling, they're not going to be fully present in the debrief. There's actually a lot of research to back this up. It's been studied quite in depth. This must be done first and quickly after the simulation. From there, we move to the understanding phase. This is an exploration of what happened in the sim, why it happened, and the motivation behind learners' actions. A lot of the discussion and feedback happens here. Learning occurs with the student's reflection more than the debriefer's instruction. Once the understanding phase is done, we move finally to the summary phase, where you wrap up the debrief with what the learners are taking away from the sim, what worked well, or what to change for next time. So I want to look a little more closely at the reactions phase. This is one of the most important pieces of the debrief. If you don't allow your learners to address their emotions, they're not going to be attentive, as we said earlier. An analogy could be made to someone attempting to give testimony immediately after a traumatic event. It's hard for them to think clearly about their memories until they've addressed the fear or anger they may be feeling. When we're highly emotionally activated, our cognitive processes are impaired. Have you ever been in a fight with someone and gotten very frustrated and said something that just made everything worse? Emotion overrode cognition and logic was ignored. The reactions phase does not have to be a long process, just enough to give everyone a chance to speak and express their feelings. For about a 30-minute debrief, I wouldn't take more than 3 to 5 minutes for the reactions phase. You can do this by asking each person in the room to describe their current emotional state in just 1 word, and that can be enough. After they've expressed their feelings, we move to establishing the facts. This draws your learners back from their emotions and into the events of the simulation. Establishing the facts of the case might also answer any questions they had coming out of the scenario, create a stronger understanding about the events as well. Then once you have all the parties on the same page, you begin the actual discussion of the sim. So before we get to this section, I just want to take a moment to stress how important transparency in communication is in this process. It may seem uncomfortable or unfamiliar first, but making your thinking transparent to your learners can help you communicate with them in a far more effective way and can also help avoid some pitfalls that we'll touch on later. So the understanding phase is really made up of exploration, discussion, and application. So for exploration, your honest curiosity is a crucial thing here. This section is not about lecturing the learners on what they did right or what they did wrong. It's exploring why did they do what they did. During the sim, if you noted down any behavior that you wanted to explore the motivations behind, this is where you begin that process. With the discussion, once you've gotten a clear picture of what the learners' perspectives and motivations behind their actions in the sim were, you can begin to introduce your own perspective. There's a technique for this called advocacy inquiry, which we'll be exploring quite soon. And then application. How do the points that you're making apply beyond the sim itself? Are there situations beyond the one that we've just seen where these lessons are also applicable? Finally, the summary phase. This is what wraps your debriefing up. Revisiting the facts of the case, the topics you covered, and getting input from your learners about what they're taking away from the simulation is what you do here. They may not have some profound epiphany right then and there. They may in fact not have much to offer up. A lot of students keep reflecting on their performance in the days following a sim. In my experience, it's been not at all uncommon for a student to reach out a few days or sometimes a week after a sim and say, hey, something the other day happened and it made me think about that sim and I realized. You may see some of those messages or you may see growth along the way. So we've looked at the structure of debriefing. Now let's talk about how we actually go about it. Communication plays a large role in how we debrief. Depending on the way we communicate our thoughts, the student's experience and what they take away from the simulation can be radically different. Oftentimes the feedback we need to give could feel somewhat uncomfortable. In debriefing theory, there are a few different camps on different techniques in giving feedback. Let's look at two extreme ends, shaming and sugarcoating. These are also referred to as judgmental or non-judgmental, respectively. On one hand, our opinions and feedback have been heard loud and clear, but at the expense of the student's emotions. We've taken the stance of absolute authority here. Our word is law. We have passed an absolute judgment on their performance, and there is no other opinion, only yours. This would be something like, class, this is an example of what never to do in this situation. Now, if we flip to the other end of the spectrum and we look at the sugarcoating feedback or the non-judgmental approach, we've spared the student, but did they really understand what we were trying to say? In an effort to soften a blow and not pass judgment, the message might get lost. As humans, we're inherently biased no matter how impartial we try to be, especially if it is in a field that we've got a lot of experience in. We have our own set of opinions around the right way to do things. These biases aren't inherently a bad thing either. They're opinions we've generated based on our own experiences. Personally, I find it easier to debrief people with whom I don't share skill sets with. Part of this is because I don't have any of my own experiences and opinions that start to muddle my thinking about their actions and their behavior in their professional environment. I'd like to think that if I was going to debrief a group of astronauts following a flight simulation, I'd be more comfortable asking about group dynamics versus diving into a debrief of a group of EMTs and paramedics, where I might get a little bit caught up in the clinical details based on my own professional experience. So where does this leave us? This is where debriefing with good judgment comes in. Good judgment technique, its real strength is in the transparent communication between debriefers and students. It helps us see things through the learner's eyes, makes discussion of difficult or sensitive topics easier, provides clear information and application for change, and it does not assume a stance of certainty or absolute authority. It's direct yet respectful, clear, and promotes understanding. Good judgment is all about clarity in thinking, in communication, and in feedback and in improvement. Let's just look at an example of this. So here's a hypothetical situation. Your students missed an objective regarding appropriate administration of IV medication, specifically pain medication. So if I were to use the good judgment technique, I'd be separating out my feedback into 3 parts. I mentioned advocacy inquiry before, and this is an example of it. I saw, I think, how about you? So what I saw was, I saw you push that medication pretty quickly. I think that specific drug is supposed to be administered over 2 minutes as an IV push. I'm curious, why did you push the medication at that rate? So looking at this here, we've got a nice structure that allows you to make your thinking clear to your students. It's just what you saw, just what your thoughts are, and your inquiry beyond that. There's no inherent judgment mentioned. You haven't said good, bad, or anything else like that. It's just the facts. This is great not only for making your thinking clear to students, but in cases that might feel perhaps a little more high risk. You're not making any implicit assumptions about the other person's thinking, and you're not putting words in their mouth. This takes a little bit of practice to get comfortable with. It feels kind of awkward at first because just through the way we're socialized as people, it's not really the norm to be making our thoughts and feelings as sort of an external monologue. I would advise practicing this a little bit before you try it on a group of students. So I mentioned avoiding pitfalls earlier as well, and if I had to pick the 3 most commonly seen behaviors in debriefing that we try to avoid, it would be these. GWIT, or a guess what I'm thinking question. GWITs are these vague, somewhat open-ended questions that really do force your students to try to guess what you're thinking. They're not really helpful, and they just kind of stress students out. Here's an example of one. So why is blood pressure important to focus on in this case? I clearly have an opinion, and it's up to my students to guess. If you find yourself asking a GWIT, AI is actually a great way, or advocacy inquiry is a great way and quick way to make sure your opinion is, or your point is still made, and it's also done clearly. So if we transform that earlier example of the patient, of the why is blood pressure important to focus on in this case, and we applied AI to that, we might get something that says, with a patient in pain who's also hypotensive, giving narcotics may increase venous dilation. What strategies may be used to help balance his pain relief and his hypotension? I'm being direct. I am telling them the exact background of this, and there's no guesswork for them. So if you compare the two, the GWIT actually didn't even have to be a question. It's a statement and an opinion disguised as a question. The next one would be solely focusing on technical skills. Sometimes this is important with a novice student because they can see and therefore remember their errors. For example, failing to raise the bed when positioning a patient. They can see incorrect body mechanics and alignment. However, skills are learned, modeled, and practiced in lab, and sim is not the place to focus on specific skills. You know, we wouldn't ask someone, oh, well, why didn't you disinfect the IV port with alcohol? That wouldn't be a debriefing point to focus on. Finally, debriefer fatigue. Being cognizant of the long simulation day. It is so easy to rush through the last few student scenarios after the debriefer has said the same thing over and over, or at least it feels that way. Each student group deserves the same amount of attention and time, so please take your time. Take a moment to stretch, get out into the sunlight, maybe ask if someone can cover the next few simulations if they're qualified, and just make sure that you do not exhaust your own brain. So the debriefing techniques we've talked about are not perfect for every occasion. When behavior does cross a line, you need to go to that voice of authority and certainty and speak out against it. We usually define that line as someone in need of discipline or counseling, someone whose safety is in jeopardy, be that a patient, client, or coworker, or even criminal behavior. Examples in the healthcare setting might be seeing child abuse and not reporting it, or restraining a non-Section 12 patient without a physician's orders, all 4 bed rails up as a mechanical restraint. Those sort of things do need to be corrected. But in those cases, when you go to that place of authority, it's important to really know where that line is and when it is crossed. So just a couple more tools for your toolbox of debriefing skills. Owning your opinions, that's a great tool to use. Debriefing can be really difficult, and there are times you might feel very frustrated and find yourself slipping towards either judgmental or non-judgmental debriefing techniques. So just get into the habit of stating your opinions as your opinions versus immutable facts. That can help you keep from slipping into that lecturing mode and speaking as that one sole authority. Signposting is another way that can help you avoid GWITs. You know, if you You can help keep them on track this way. It helps keep them organized, helps your thinking to stay transparent for the students. And finally, just be curious. Being sincerely curious about your students' take on a situation can help you understand so much more about their actions. It can help diffuse some of your assumptions you may have had about their thinking and maybe why they picked the actions that they picked. And finally, in summary, we'd like to leave you with just a brief overview of some of the things we talked about. Thank you very much for your time.